and welcome to another wonderful talk at the Positive Future for Health podcast. And I'm your host, Althea Finch. I'm the creator of the Pain Free Method. How to be pain free by tuning into you. And you can find out more about that at painfreedom.co.uk. And as well as teaching people how to be pain free with my methods, I run this podcast and I come across the most fascinating and amazing guests, people to come along to invite to the podcast. And I created the podcast because I felt that gap between what I can teach you and all these other wonderful people. And I just felt really that surge to create the podcast and bring all these lovely people on to teach us and share with us their highly experienced knowledge and guidance. So on tonight's podcast, we've got Corinna Cooper, and Corinna is a physiotherapist and then some, and a lot more than that. No, you're going to correct me, I'm sure.
Well, I'm
And we
just going
met
to say although it is spelt Corinna, it's Karina. So
Corinna. Thank
that's
you.
everything else is great, but yeah, Karina. You have to remember Karina.
I thought it was. I thought it was Karina, and then I heard somebody call you Corinna. I thought, oh, maybe I'm saying it wrong.
Yeah, I have a
Karina,
couple.
lovely.
I don't mind essentially, but if I don't correct, then you carry on saying it wrong, and other people hear
Yeah,
that, and then my name
I
changes.
know. I'm glad you did. Okay, and Corinna, she's going to be talking to us
Oh,
about um
Karina.
Karina. Did I say it again? Oh no, bad
Yeah.
mark. Karina is going to be talking about a spinal tensegrity for optimal health. What is that? I don't know. So, but Karina does. So, Karina, what is it all about? How did you get into all of this? What's your passion? What brought you to all of this? Who are you?
Well, physiotherapist by trade, and discovered that physiotherapy doesn't provide enough of the skills that we need to look at people holistically in a structural way. So I had surgery when I was 7 to have my appendix removed, and essentially a back pain was the sequence of that many years later. So after qualifying as a physiotherapist, I had less than 6 months pain free before I had an incident at work, and that started a pathway of chronic pain. So prolapse discs, arthritis, other bits and pieces. And even a 5 minute walk, I wasn't able to do for a good 5 months at the worst of my disc problem. So, come from really debilitated and obviously had the core skills based in physiotherapy to be able to learn and build on my experiences and reverse a long-term chronic problem.
Wow, that's all in a little capsule, but can we unpeel that a bit? So you've been suffering since seven? Seven,
Well,
seven.
no, this is one of the misconceptions about surgery. If a doctor says to you, oh, it's keyhole surgery, people tend to think that scar tissue isn't an issue, but it absolutely is. So the reason why I brought up my surgery is because that started some scar tissue in my abdomen and pelvis that led on to the chronic back problem. That was the core. So although I didn't get any pain until my early 20s after qualifying as physio, I did have a couple of twinges in my teens that something wasn't quite right, but nothing that lasted more than, an evening playing cards or something. But I ended up having 14 years of chronic pain, which I managed. I got some help initially, and the worst of it was staved off, but it was managing it rather than restoring health. With my work, I do courses to learn more. And on some of the fascial work courses, I discovered um, real benefits from the fascia work. So we'll go on to that. It's not the first thing I'm going to talk about because I'm going to talk about the spine as separate units. So if
Yes, and
I'm going to bring my model in. Any
bring your
thoughts right
model in.
now? Yeah, bring my model in.
I'm hoping you're going to say more about yourself because
Oh, really? What do
you're
you want to
wonderful.
know?
Well,
Okay.
what made you interested in this field? I mean, was it your personal experience? Was that what
No,
triggered it?
when I was young, I liked sport, and my mum was a bit of a helicopter parent, so took me to a careers day, and had all these prints out, and I was sort of looking down. I think there must have been about 50 different careers listed, and when I saw physio, I thought, oh, that's good. I'll try that. That was it, really. And it was all very sports orientated. So I'd done a couple of days at Bupa Hospital just watching people do outpatients because I don't think I was intelligent enough to get in without having a bit of experience. So yeah, all quite sports orientated to start with. And I think helping people.
Yeah,
I
so it
think
all
I'm a
sort of
natural healer.
yeah, it's all the ingredients, your own personal and the study and the and your mum, all sort
Yes,
of fit
yeah,
in.
yeah.
Show
It
us
was
your model.
show us your model. Right. I don't know if I can get far enough back. I'm going to take him off the stand, but this is. I'm not going to take him off his stand. He's stuck in there. Ooh. No, he is a bit big. Which side do I go? Okay. So essentially, this is a lovely model because it's got little foams in where the discs go. And actually, I mean, it cost me nearly £500, but you can sort of twist it and bend it and hold it. So that's what's really useful, is to see that one's structure, if one has balanced muscles, is straight. But because we've got all these separate parts in the spine, this is what I'm talking about the spinal column not being one pole. It's separated into joints between the backbones, and between the backbones and the ribs. So essentially, what I wanted to do is to help bring some insight into what our body looks like on the inside, because
Mm.
I imagine for most people, between the shoulders and the pelvis is just a rectangle. You know, maybe they know there's shoulder blades in there, but all those separate parts with the vertebra and how it should move and all of that kind of thing, we're just not aware of. And one of the things that dovetails really well with you, Althea, is you've got to know, you've got to be listening to your body. If you want to get better, you've got to connect with it. So you might be connecting with pain or symptoms, and I get people to do that too, but I'm also looking at people exploring how their body moves, getting an understanding on what bones are where, and also how it's meant to move. Now, the
Absolutely.
problem with our bodies moving is it's the body movement that helps to keep the brain well. And our brain, in order to feel safe in our body, needs to have movement. If we sit and don't do any movement outside of that small comfort zone, then the body doesn't feel safe going outside of that. And that can communicate with stiffness or pain or other bits and pieces. So essentially, symptoms are multifactorial. You may know about trauma that gets trapped in the body, spiritual side, the mental, as well as the physical. So obviously, I came from the physical first, but remembered in the hospital someone saying there's a certain flag system that we're taught with regards to people's social situation. So red flags are when something's serious, it's not social, it's to do with maybe you've got cancer or something urgent, that's a red flag. But we get taught things like yellow flags. So if someone's got back pain, but they've got a job that they don't like, you know, and there's issues with the boss at work, that would be a yellow flag. So during one of the sessions, I remember someone bringing up about yellow flags and mental health. And I'm thinking, you know, it starts with a physical problem, but then you go somewhere and don't get any help and it becomes a psychological problem. So that frustrated me a little bit, that it's like, oh, it's psychological, you know, because they don't like the job. It's like, well, actually, there's very little effective therapy out there for people. They don't understand what the problem is, and the psychology on not knowing what's wrong plays a part too. So sometimes people come to me just wanting to know what the problem is. I explain it all. I explain the solution. They go, oh yeah, I'm not really worried about investing that time. As long as I know it's, you know, what it is, then they're all right with that. You know, I encourage them to look after themselves because it'll only bite them at some point in the future.
Well, your little we did a little swap. We actually met recently at the Shine seminars, which were terrific. I do recommend anyone goes to that next year. And also, and then we went to another one. We've all been busy this summer.
Festival weekenders.
Festival week. And yes, we met again at the Wellness Way with the Philly J. Lay and Barbara O'Neill and everybody, which was amazing as well. Do go on to that one next year, everyone. But then we did a swap together, and you were actually terrific. I mean, I'm an information person. I like to know what's going on there, and I think you're absolutely right that knowledge is power. If you know what's going on, you know what to do about it, or you know what to point yourself which direction. And you went through I guess a short scenario of a consultation with me, and you photographed my side and my back and my front facing different ways, and you pointed out, look, Althea, look how the material is dropping this way, that's because of this and that. And I thought, oh yeah, you know, you pointed great detail out. You're really, I love a bit of A&P and anatomy and physiology. I'm a therapist for 30 odd years too, and I love all the information about the body, but I mean, talking to you is like even I struggled because it was all
Yeah, I do
lateral,
tend
bilateral.
to monologue in the level that I'm at,
And it was
and it
perfect,
can
but
be challenging.
so
Yeah.
informative because these
I
Latin
mean, I
words
think
and
that's great for people like you who work from information, but I know sometimes it's a bit rabbit in a headlight, because I'm delivering a lot of information that people aren't familiar with. So I think the problem is for me is I did physiotherapy first and I learnt all the information and then I worked out how to fix it. So for me, if I want to help people to fix it, they need to know, certainly that there's
yes,
different joints up the spine that all need to move. So I
yes.
think that was part and parcel of that. So one of the courses that
That was
I
great. I really appreciated that because it showed me exactly what you were talking about. But even you
yeah,
pointed out sort of layman's terms, like, the material of my clothes were dropping a certain, or you said like my chin level or something. I forgot now,
yeah.
but and it
Well,
really informed me, it was great.
Well, I did a session different with you, knowing that I wouldn't see you again for a follow-up. So my assessment of you was really finding out what tools I could give you that day to get you started on understanding where the body is and, the core bits that you need to be loosening and focusing on because the symptoms might be a little bit further away from where the problem is. So yeah, I focused on self-treatment with you, whereas other people I might be looking at doing manual therapy on the joint dysfunctions as well as that. So yes, it
That's
was a bit
perfect.
shortcut, but it was trying to give you the information that you would require.
Yeah, but highly detailed and really focused, and I really appreciated it. It was so
Yeah,
informative.
I am a proper nerd when it comes to anatomy.
Proper. I
Proper
loved,
nerd.
even in the lateral and the medial, and you had words I hadn't learnt myself.
Well, you know what it was, Althea, is when I was at university, I very much had an upbringing where, you work hard, but you play hard too. And I'd forgotten some of the work hard while I was at university. So there's plenty of playing hard, plenty of drinking. And then when I qualified, there's other physiotherapists going, I'm a physiotherapist. And I was like, I'm a physiotherapist. What the hell do I do? So I was in my books quite a lot. Like I said, my first placement was outpatients. So I needed to know the anatomy. I need to work out what the problem is. It's not a case of perhaps on some of the inpatient physio roles, you go, oh, come and sit on the edge of the bed and now try and stand up. So the knowledge level had to be quite up, hence why I was busy. Right.
brilliant. You're brilliant.
I had the opportunity to get laminating today. I've had a whole bunch of pictures that I've been meaning to do for about a year. I was
Okay.
around Cheryl's last time and I got a bunch done. But anyway, the first part of my talk was about how the spine is not one column, but it's lots of different bones. So I've brought some pictures to have a look at. Um, let's start at the pelvisy bit. Okay, I'll try not to get the shine on too much. But this is from the knees into the hips and pelvis, and it's got the lumbar spine as well. It's also got the last rib, rib 12 on each side. Can you see the highlight? That's the joint. So the
Mhm.
triangle bit in the middle is the sacrum, and then you've got the two hip bones, and that's just highlighting the joint. Now that joint, I've heard physiotherapists say, oh, it doesn't really do much anyway. That's the main transferring of weight from your central control zone into your lower limb. So
I can't believe
it doesn't
that's
have a big
shocking when you
range
say
of
that.
movement. Doesn't have a big range of movement. So you need to be astutely skilled to assess whether you're stuck. But it's really important. I had one girl who is a daughter of one of my friends, and I was saying about scar tissue from surgery. So she had had surgery in the November to have her appendix removed. And then I think it was about February or March, she was doing sprinting at school. She slipped on wet grass and she fell onto her bottom. She hurt herself, but she kind of got up, got changed, and then was sitting in history. And then 20 minutes later, she says, can you tell the teacher that my left leg has gone numb and I can't move it? So essentially, what happens in Western medicine is like, oh my goodness, numbness must be a nerve problem. So she gets taken to A&E, they x-ray, there's no bones broken. The symptoms are sort of tingly and numbness. Oh, that's a nerve. So her diagnosis was, you've trapped a nerve. Now, I've got a slightly more
And what?
focused. Yeah, I'll tell you what happened. So this is a picture of the pelvis and the lumbar spine. When she slipped, she landed on one of her sitting bones and she disrupted her sacroiliac joint. So the muscles up in the lower back and the pelvis were having to go into spasm to carry the weight from the upper body down into the leg without going through that joint. She couldn't walk properly. She couldn't weight bear properly. Well, because her mum knows me, she called me and said, "Oh, she's been at A&E today with her pelvis. Any chance you could see her?" Well, back in the days pre-COVID, I was busy all the time. So I said, "Well, I'll come to her before work. Will you be up by 8?" Yes. So I went round there and there was pelvic alignment issues. There was scar tissue problems from the appendix as well. So I did a pelvic alignment treatment. They're osteopath based, sort of historically, the treatments I do. But she got up, she was like, "Oh, that's much better." And she was weight bearing through the joint correctly. Anyway,
Mhm.
she was a fairly high level gymnast as well. And I'd said to her mum, see how she goes for a couple of days. I'm probably going to have to see her next week. Well, I felt it went without saying, don't go to gymnastics on Friday. But I get a phone call on Saturday. "Oh, she felt fine. She was so much better. So she went to gymnastics. She's not managing now."
Mhm.
So I had to growl at her. I think I was watching football back when I was really into football. It's the World Cup on a Sunday. I was like, "Look, I'm going to be drinking. If you want to bring her around here, I'll treat her before the match starts. But otherwise, I'm written off." So anyway, having to explain to people that if you've had scar tissue in the November and then you've disrupted a joint enough to take you A&E, you're probably not good for going doing high level gymnastics in 2 days' time. So anyway, there's some education that's required because people don't know. So anyway, those more pictures of bones. This is a side view, which I think is quite interesting. We've got five lower back bones, but this bit here is the center part of the pelvis. My eyes are backwards. Hold on. That's the center, that's the sacrum bit. So you've got two hip bones either side. And as you can see, it doesn't come straight. We get a little bit of a I've got some neurodiversity issues as well.
Okay.
But the angle in which the sacrum comes out. So, for example, morphologically, we're different between races or different types of human development. So Asian, Indian people would tend to be much smaller. African American women will often have more of an anterior tilted pelvis. So them having an anterior tilted pelvis is normal for them. So there are some differences between bodies, and you need to be aware of those. But these are my pictures showing that this is the latissimus dorsi. It doesn't matter. It's a shoulder muscle. It comes up into the arm, but it's all the way to the pelvis as well. So if you imagine people don't move their arms very much, come overhead, and these muscles get tight, you're giving yourself a back restriction straight away. And I don't know if you can see, but that attaches to all those backbones here. So where I'm talking about all the backbones being separate, we need to have balance in the muscles to hold the bone straight. When you are in a tent, they have a solid tent pole, but it isn't the pole that holds the tent up. It's all the guy ropes being balanced. So this is another shoulder blade. This is a shoulder blade.
I love that, Karina. I love that about saying the tent and the guy ropes because that's exactly how it is, isn't it? Because we all
Yeah.
get that. So the muscles and the tendons and everything, it holds the body.
Yeah, it has to be in balance. Our whole 3D matrix, our fascial system needs to be in balance. So if you've got a knee pain, you have to look at the structure and see whether the knee pain is coming from the knee or the ankle or a hip, or they've got a really awful neck and it's just tracking down from there. So one of the reasons why I brought out these pictures is because you can see that the shoulder blade muscle, this one, attaches from the skull to, right down at the bottom here. So if you've got a weak muscle in your right arm or shoulder and you're not using this side properly, then you're going to get spinal problems. Tennis players who will serve a lot with one side have to do a lot of work on the opposite side, otherwise their spine will start to change shape because you'll have strong muscles on the dominant shoulder side. So when I'm talking about spinal tensegrity, tensegrity is an amalgamation of tension and integrity, and it's our
Mhm.
body working the bones and the connective tissue more like a suspension bridge. So we're not a compression bridge. It's the balance of all the cables that holds us in a good position. It's not the thigh balanced on the shin, balanced on the ankle bone. And I remember particularly a
Love
picture of
that.
a knee joint. Sorry?
I love that analogy. It makes it really clear. I think so.
Okay,
Doesn't it
good.
make it? Karen's nodding as well. So.
When I was doing GCSE, there was a picture of a knee joint. So we had a thigh bone and a shin bone.
Mhm.
They weren't dislocated. And there was gap and there was fluid and there was a synovial capsule and a joints capsule. And there was a gap between that. And that gap is from the tension in the connective tissue. So there was one chap who was a body worker who had some knee surgery and he said to the surgeon, can you try and put the bones together? And you can't get the bones together because the tension in the tissue is deliberately holding that apart. This is why when people's arthritis gets so bad, it's actually a breakdown in the balanced system of their connective tissue, and
Mm.
it prevents the tensioning of the tissue to keep the joints separate, and so
So
you'll lose.
just say that again. I think that's really important for people to know, to hear that again.
Okay,
It's
I'll try.
it's the tension in the muscles and tendons.
And the connective tissue that won't let the bones be forced together. And it is that balance in, hi Lena, it's the balance in all those the muscles. So when people's movement system is so poor that the lower limb biomechanics is getting worse and worse, it won't be able to hold the joint apart and you'll end up getting bone on bone.
Mm.
That isn't a compression problem between the thigh and the shin, that's a tension problem throughout the body.
Tension. And I always say the number one side effect of any pain or stress or strong emotion or trauma is tension.
Absolutely.
So one of
Yeah.
the answers is relax more, isn't it? Do things that
It's,
stretch and
yeah, it
relax.
certainly is. But the problem with why people get tension. So if, for example, I'm going to just show you another picture. It's got shoulder blade muscles on, and it's showing you that there's a chunk of vertebra that attached to those shoulder blades. That's the rhomboids. But if you're getting imbalance there and you've got a tight rhomboid on that side, it's going to affect the joint between there and there, maybe, and there and there. So you can get a
Bone.
single segment where the joint's not, you can get a twist. And I know the very top bone in the neck is called the atlas. C1 is called the atlas. And I've had adjustments there. Essentially, the muscles on the back of the neck and the head, they trigger with one of those massage guns and do a bit of release down here. Um, and the difference, like I've obviously had structural problems for a long time. I was 7 when my appendix was taken out. I grew with that scar tissue. My first indication of a back problem was probably 21, 22, and a good 10, 15 years. That I managed the back pain in that, like the acute problem was about 3 weeks, and I noticed a year later I was getting shoulder blade problems. That was because the muscle got tight lower down. So the other thing to bear in mind in your guy ropes is we don't have a solid pole. So in a spine, you've got a guy rope here and a guy rope there, holding it balanced. And you might have one at the front and in the back as well, but they'll be all at different levels. So if you've got a guy rope that runs out here and that's tight, that's going to pull your spine at this level over, and something will have to cheat or compensate somewhere else up the chain. Now, I've focused on spinal tensegrity because that's our core. When people talk about our core, most people imagine it's from the rib cage to the pelvis, that middle bit in the trunk. But our core is the axial skeleton. It's the whole lot from in sitting from the pelvis to the top of your head. And actually, if you're in standing, that core goes all the way down into your feet as well, and that needs to be balanced. Now, I don't have a lovely laminated picture of this, but I'll see how it goes. This is my course notes from the course I went on in 2010 called Anatomy Trains. This is the deep front line. Don't know if you can read it, but it says it's our core line. It's volumetric because the connective tissue goes around the heart and the lungs. So, when people yawn and the scientists say, oh, you yawn because you're low on oxygen, or you're tired, or you're this, or you're that. Don't believe that. This
Okay.
is a picture on the uppermost part of the deep front line. I don't know if you can see, there's got one attachment to like the skull, one on the neck. Can you see the red lines there? I know it's not very easy to see, but can you
Not
see
really.
the bit that goes around the heart?
Not really, to be honest.
Okay,
Just describe it and then we can get it.
okay. That little bit there is the heart. It's the connective tissue around the heart. And then those bits in front and back is the lungs. So essentially, the line of tension
Mm.
comes from our skull and down on the inside of our body, inside the pelvis, down into the feet. We've got layers on the outside. So we've got one core that supports the spine all the way up, and then we've got the abdominals and around that. So we've kind of got two cylinders. Um, I mentioned the course I went on, that deep front line. That's not a very good picture. But essentially that gave me a method in which I can assess someone's structure. And it gave
Mm,
me the language and terminology, which was patchy in some of the physio, to describe how the positions of the bones have changed. So complicated joints, for example, the shoulder blade and how that moves. It kind of can come around the rib cage sideways, but it also rotates sort of up and down. And
yeah.
there was different language, but the anatomy trains essentially taught me the complete picture, because although I've shown you the deep front line, there's one on the surface on the front, one on the surface on the back, a couple of crisscrossy ones, and it's the balance of all those different lines that I look at. So when I was looking at you and looking at your chin, if you have a tilt to one side or a shift, then that is having a knock-on effect on your spine. So when I look at you, I'll be looking from the head down, whether there's a slight tilt sideways, because that'll mean some of the muscles up at the top in the neck are going to be tight, and that's going to be affecting the balance. So essentially at physiotherapy, we were told, check what level the shoulders are at, if there's any creases in the waist that are different. So normally if there's a spinal dysfunction, people have a crease on one side and then a different crease on the other, because maybe this one's twisted that way, is deeper, and this one's twisted that way. So you get these little creases you can see in the spine.
Because you did not only me, but you did two or three other of your friends at the place, and it was fascinating watching you because you'd point out things that I as a therapist I missed it as well, and like you'd say the ankle was tilting in or turned, or the toe. When one of the other girls, I remember you saying like, look at your toe, look at
Rolling.
that toe, it's rolling, and you had a little chat with them about that, and then when we showed you the there's little dots at the back, everybody at the lower back, you've got these little dots in your flesh where the sacrum is at the lower back, everyone, just
Yeah,
in
the dimples.
the dimples, and
Yeah, I'm a
there's a
dimple
whole
observer.
dimple observer, and you had a whole conversation about if it's doing this and if it's doing that. It was just really highlighting. And when you know the information, what's happening in your own body, you know what's going on and you can do something about it.
I think this is where I have the advantage over you. People need to have faith because your healing method is a little bit more abstract. I mean, when you told me what it was, I completely aligned with that because, there's other methods out there. Old pain to go, listen to your body and it will dull down the messages straight away, particularly if you're committed to getting it better. So, I was already sold into that. But one of the advantages I have is I can touch some tight tissue and then people can feel that it's different. So, where I've got the knowledge and saying it all, it's backed up by a bit of work that feels different. And I think that's the advantage. I do feel like I'm on a sales pitch a lot of the time because people don't want movement and nutrition and breathing as a solution often, um, because we're culturally much more along the line of pharmaceutical management, which doesn't do anything to restore health. It
Yes,
generally just turns the body's
exactly.
signaling off. There's a problem, and we just you tell it to shut up. Now, I don't know how easy this will be.
As you said right in the beginning, you said you learned to manage, because if you don't know and you don't understand and you just learn to live with it, or you just listen to the doctor and hope he's right or something,
Or
but
even a
managing,
qualified physiotherapist who'd had a degree, 2 level, granted, but had a degree, couldn't work out her own problem. It's difficult. But that's because structural integration was never part of our undergraduate program. That was a course I went on afterwards. And the
uh,
work I do now is all structural integration. Yes, I've got my physio, my massage, mobilizer joint, but it's no good me doing that if I'm not assessing their structure, because a stiff joint will be a stiff joint. I can mobilize it all day. If that's stiff because there's tightness in the muscle from the pelvis being malaligned, then I don't want to be just mobilizing a stiff joint. I've got to get to the primary problem on why the body's not balanced. This
perfect.
is a tiny little muscle, but it demonstrates that our guy ropes go from one bone, and this one is actually onto the ribs. Now, when I qualified as a physiotherapist, breathing exercises, breath work, yoga, what's that all about? And in my naivety with the musculoskeletal system, it was about, breathing's about training the lungs. Absolutely not. The breathing exercises about training the muscles that move the rib cage. when people get old and die of pneumonia, it's not pneumonia that kills them, it's the lack of movement in the rib cage that prevents our normal immune system function. So it gets trapped, the mucus gets trapped down there. So, if breath work feels a bit yogi, get over it because there's mechanical reasons why we need to expand our lungs.
Yeah.
This is a very complex picture. I'm not going to ask any questions on it, but I want you to see how complex the guy ropes are. Ugh. You see, there's some that go from one level to the next level, some that loop round. If you don't move your spine, how healthy are these muscles? How many of you know where your stiff vertebrae are? So,
You don't, because the body's a self-balancing system. I find that when I was used to do hands-on body work, often people would say, "Oh, didn't know that bit was tight," and it just because the body's a self-healing system. You always feel like you're kind of okay all the time.
yeah.
So it's
Um,
really important to get it assessed, or if you feel a twinge, go and get it sorted out with somebody.
Um, the problem is that we accommodate. So if that's how we move, that's normal for us. Same as these teenagers in that posture. You think, God, that can't
Yeah,
be comfortable. Well, if they've sat in it for a while and the brain goes, oh, that's not comfortable, and they've ignored it for long enough, the brain goes, oh, not listening. And then people are able to do that. Quite often, this is a quote from an osteopath, someone Mitchell, Fred Mitchell, I think, who said that seldom is it the problem that complains to us. It's usually a secondary problem in the body from a primary problem elsewhere. Now, when you think of our methodology in our Western medicine system, it is about finding out what symptoms you are, labeling it with something. You've got arthritis, you've got MS, you've got this, you've got that, and then providing symptomatic relief. So you manage people's health expectations by saying, well, expect to be unhealthy, and this is what you can do about it. You can take some drugs that will stop it moaning so loudly. Now, if you were having problems with your car, it's making a funny noise, if your mechanic says, oh, it's all right, just turn the radio up, oh yeah, turn it up louder, you're not
yeah.
going to feel reassured that that mechanic knows what to do. But that's our Western medicine system. Same as if you go to the mechanic 4 times for the front left tire, you need to keep replacing it. Like, I'm a woman, and even I know maybe the tracking needs looking at. But this is what they do in Western medicine. I had a lady who came to me and said, oh, this is my third knee replacement, all on the left. They won't let me have another one. And I'm thinking, tracking problem, ankle, hip, you don't need a new knee. The knee is what is complaining, but it's not your primary problem. If you've already
I
had two
totally
new
agree.
ones or three new ones, you don't need another one. You need to
I
find the reason why your knee's hurting and not just listen to
totally
the
hear you.
doctors say, we've got a solution for a knee pain.
Looking at your body as a whole, and people like us in natural therapies or anything holistic, they'll look at you as a whole. Anything that says it's a holistic therapy, whichever kind of technique you go for, and or somebody looks at you as a whole, the whole body, not just your knee.
Yeah, the
I'm
problem
totally
is
with you
Western
on that one.
medicine realised that people weren't happy with the biomedical, so then it went to a biopsychosocial, and it isn't holistic. They say holistic, but it's not. It's separated. If you've got a problem with your foot, you go to the GP and doesn't fix it. You've got a foot specialist. The foot specialist won't know about a shoulder problem and whether a pec minor tightness is causing their pelvic issue. Anyway,
Absolutely. Holistic, look at the whole body. And of course, it's not even just the body, is it? It's your emotions and your stresses and don't
yeah,
like your boss or don't like where you live or your partner or something and something. It all goes into the
absolutely.
body. It reflects in
Now,
the body.
when I had, yeah, the body keeps score, right? When
Yeah.
What did you just say to me? You triggered a thought. I'm looking for a picture. Can you remember what you just said?
All about holistic and it's not just about the body. It's emotions and feelings and what
Yeah,
you've been
thank
through.
you. Now, I don't think I've got a particular picture of the muscle, but where the pelvic bones are here, we've got a muscle on the inside of the pelvis and then one that comes up into the lower back, hip flexors. It's complicated, but because it moves the hip and it stabilizes the lower back, it can start to cheat the wrong way. Anyway, I'd been taught some of this fascial work. I was taught on the course, people carry their emotions as well. So if you're releasing in the hip flexors, don't be surprised if they cry. Well, this was about a week after I'd been on the course, and I'd said to the lady, oh, I'm going to do some work. You're really tight. I'm going to do some release work around your hip flexors. By the way, trap emotion there and you might cry. Well, literally 5 minutes into it, she's lying there, she's going, I don't know why I'm crying. The tears just pouring down my face. I don't feel sad. And I was like, wow. I was like, oh, that's an emotional reaction. Well, of course, years later doing it, I never warn people now, and I haven't actually had a really bad reaction. I think that was just the messages to make me learn that emotions connected. So I take that forward. I forget to mention people, but if they do, I'll go, oh yeah, don't worry about that.
And it's true, isn't it? Because in this present moment, they might be completely disconnected, but as on some level, they want to release it because they've come to you and you're doing some stuff to release it, I believe.
Absolutely.
And that might have come from when they were little children, from whatever has created that, or a lifelong of heavy lifting and stress and strain or whatever it is. So those emotions can just burst up like a bubble and be uncontrollably crying, but it's actually
I
okay.
have been told by one of my clients, oh, you could be a psychotherapist. And I'm thinking to myself, well, why would I want to do that? Yeah,
Brilliant.
it's really important to listen. I think one of the biggest failings of Western medicine is someone coming with a symptom and you might get a response with, oh, no, that can't be that, or, you're wrong, or that wouldn't have caused that. Just, I don't know, in the conditioning. But yeah, have an open mind. So structural balance. So we've spoken about the spine being separate. That does carry into the feet as well. So it is the whole body, which is why you can do reflexology on the palm or on the foot or on the head. And because it's the peripheries, it will track what's happening in the body. So it doesn't have to be the feet. You can do hand work as well, and that will normally tell you what's going on through. Because it's almost like if you're in a balanced system, like if you collapse on the inside of one ankle and you drop your arch, you're going to have to get tighter and shorter on the outside. So quite often people will be tight on the outside and it can't go anywhere else. It's at the end of the
Absolutely.
feet, it's in the hands and sort of in between all of that.
Absolutely. So we
So,
have got some time now to open up for questions. So while we're going to keep chatting, if you want to ask Karina some questions or just ask her about your particular physique or body, do go ahead. You're able to unmute now, everybody. So Sally, do go ahead.
okay, I was just going to say, this is a
Please.
picture. I want to just give you an insight in the different directions that the joints move. So in all the joints of our spine, at different levels, they've got varying, one will rotate more and one might bend more. But in every vertebra, we have turning, that happens. We have flexion and extension that happens, and also side flexion. Now, people with a bad neck, and I say, oh, can you bend your ear towards the shoulder? They'll do that. And they won't be able to keep their nose at me because they're trying to do that and the muscles are tight and they'll pull them one way or the other. So if you're wanting to gauge for yourself how balanced I am, what we do, the art of a manual therapist is asymmetry. So if you're standing looking in front of a mirror and you've got a big gap between one arm and the waist and a little gap on the other, that's telling me probably that your rib cage has shifted one way and that arm is left dangling in space and the other arm's coming close to the body. So see where your arm's at. You'll also notice sometimes a difference in the shape of the shoulder because we've got muscles there and it's kind of on a triangular bit between the collarbone. So that triangle, if you like, can be pulled forward with tight pecs or upright in a dancer that's overusing their shoulder blade muscles at the back. So those are the things I would key in, is having a look at your symmetry in standing and then looking at your range of movement. So for example, in the neck, if I can turn this way and don't get any further, but I can go all the way this way, then I know I've got a problem in restricted movement. The way in which you would try and rehab, ideally, but it's a bit of crossover, is get the movement back. It's no good getting strong in this position. So you've got to try and get as much range. So each of the joints that's stuck, you move. And then you can work on the strength and the balance. So have a look at
Lovely.
what you look like in a mirror. See if anything looks tilted to the side or shifted or twisted. Range of movement, looking left, looking right. Again, seeing if there's evenness in the movement. The quality of movement as well, because you might turn and jerk one way and then be smooth the other. So we're looking at the range of movement. And the T, the final part of the art, part is the tissue texture. So you know yourself, if you feel a muscle that's unhealthy, there might be a knot in it. So those three in combination, the asymmetry, the range of movement, and how the tissue feels, is enough for me to use the anatomy trains model of where all your lines go to work out what I've got to do and which bits to touch.
Lovely. We'll never look at ourselves again in the same way in the mirror. We'll be doing, I can imagine everybody, we're all going to be doing, oh, what's on my arm? And so,
And
Sally,
to look and see if your face is rotated, we look and see if you've got a bigger cheek compared to the other. So things like that, or on the corner of the jawline, you might see that clear in space and this will be tucked in the neck. So those are the things, obviously, I've been doing it for years, but you can look at yourself and some people would notice that. They'll say, I've got a bony bit here. It isn't necessarily extra bone, it's just the spine shifted away and it's looking more bony. Things like that.
yeah, thank you, Karina. Sally, do go ahead and ask your question.
Yeah, hello, Karina.
Hi.
Um, Thanks so much for all the information.
You're
I think I've got a tight diaphragm. Do you have any solutions?
Well, the diaphragm won't be tight in isolation. The diaphragm is one of our, one of our diaphragms. It's the respiratory diaphragm. Diaphragm would be something that will come all the way through cross section of the body. So we have lots of muscles that run up and down, but we don't have that many that go through. The problem with a tight diaphragm is it links into these hip flexor muscles that I was talking about that attach into your lower back. So I don't know if you've heard the name psoas. Maybe if you're in a sporting world, you would have, but diaphragm and psoas interlink. So
Yeah.
there was a lady called Ida Rolf who did structural integration many years ago before the guy I trained. Sorry, say again? I think I might be getting an echo.
Let's just put you on mute for the moment, Sally, but do keep talking, Karina, and that hopefully will
Okay.
be okay.
I think there might, no, that is better. Yeah. Where was I? Yes. So the diaphragm is part of the internal core cylinder, if you like. If you've got a tight diaphragm, then there's going to be reflection in the pelvic floor. So the diaphragm's 360 all the way around the ribs. It's a little bit like a jellyfish because it's got that circly bit at the top and then it comes back with a couple of legs onto the front of the backbones. And from the front of the backbones, our hip flexor, psoas, comes. So the diaphragm links in with the tendons of the hip flexor. Now, Ida Rolf would say that they're so connected that the diaphragm's a walking muscle and the hip flexor's a breathing muscle. So if you've got a diaphragm tightness, you need to be thinking the diaphragm's the top of your cylinder, the pelvic floor's the bottom of the cylinder. Quite often, this is why we need to do spinal alignment, because if I've got an overarched lower back, then my pelvis faces forwards and my ribs face forwards, and the rib needs to face the pelvis. So you'll need to, for a diaphragm tightness, the way the diaphragm works is when you inhale, it gets short because it's contracting in. It doesn't pull the rib cage in at the bottom because all the shoulder blades sort of hold the ribs out. But when you're breathing in, the ribs are coming up and expanding. And when you're breathing out, they're coming down. The diaphragm, when you're breathing in, is contracting and getting short. And it's when you're breathing out, the exhale, that the diaphragm's going into its longer position. So forgetting about the rest of it and the structural balance, twitchy. If I was looking at giving you exercises to help the length of your diaphragm, I would get you doing breath work, breathing in, breathing out, trying to breathe low. Lots of people breathe from their neck and their shoulders and their upper chest. So it'd be about relaxing that and trying to focus the breath down into the tummy. That doesn't mean the rib cage stays still and you breathe just from the belly, which is what I did originally when I was taught diaphragmatic breathing, because proper breath comes from the diaphragm and a lateral expansion and a lift up. So it's a 3-part breath that they'll say for yoga or something like that. So if you've got a tight diaphragm, you want to be working on the exhale. When we give our body a bit of time in a space, the stretch is more effective. So in yoga, you'll hold the position. Depends on how good your respiratory system is. Can you hold your breath out with no air in? That would be called suspending the breath. So you get rid of all the air in the lungs and then hold it without any air in. That's going to give you the optimal length for your diaphragm. You can hug yourself around the tummy and squeeze because our organs are under the rib cage. And if you put pressure around the tummy, that will push the organs up into the diaphragm. So that might not be comfortable, but breath work, exhale for a tight diaphragm. Incidentally, doctors, when they diagnose a hiatus hernia, that's where the stomach comes through the hole in the diaphragm. So you've got your feeding tube coming down, and a diaphragm getting tight flattens from its dome shape and presses on the stomach. So often people get diagnosis of hiatus hernia, and if you Google what causes that, they go, oh, could be a weakness in the diaphragm. It's an imbalance in your structural integrity through the body, and it's manifesting at that part in the diaphragm, I think.
Wonderful. Thank you. Wonderful. Thank you so much, Karina. Thank you for your question, Sally. Do we have another question? Would anyone like to ask a question about your own body, or perhaps scar tissue, or perhaps you've had an operation and damage has happened in your body? I do get a lot of people who come in my world who have had problems after having an operation, not just scar tissue, but there's been quite a few people with nerve problems of damage to the nerves. Wants to ask a question. Do you have any exercises to help with abdominal scar tissue?
Um, Scar tissue work is quite specialized, and it's actually more light and gentle than you would imagine. So there's two different things you could target. Movement is going to be helpful, but if you've got a patch of scar tissue in between a muscle, then usually when you move, the scar tissue moves as well. So I usually use spiky massage balls or foam rollers or something else to be able to compress the scar tissue. I use my fingers a lot as well. But with regards to exercises that you can do, as you all know now, being spinal experts, the spine will rotate, it will flex and extend, and it will side bend. So those would be the exercises up at the neck. You could do it in sitting, or you could be lying face up. Make sure you're long in the back of the neck so the chin tucks in, because we always sit with round shoulders and chin forward. And in that position, gravity will help us to have a better posture. But you also want to make sure that you're not lying back with your chin poking up. So get the knobbly part of your skull as far away from your shoulders as you can, and maybe even engage the shoulder blades a bit so they're down. And that would be the position I would start in. I would keep my shoulder blades engaged. I'd keep my length in the back of the neck by engaging these muscles, and then I would practice rotation. Now, with regards to scar tissue, you could touch it, feel it, move it. Let me give you the name of a YouTube channel. There is a channel called Block Therapy, and that is looking at the fascial system. And I think to do the course, you have to pay some money, but she's got this beautiful looking block that she uses. I think the first place is in the tummy to target the diaphragm and the hip flexors. But essentially using the block and breathing. So you stay on the block in your tummy 2 or 3 minutes, and that's enough for the stretch in the connective tissue to have some effect. So that's block therapy. So if you look up YouTube and put block therapy in, you'll come up with loads of videos that will talk to you about various different parts, including how youthful you look, because that's a fascial problem. Quite often we're being pulled back from here, so we get a hairline that goes backwards as well because of the tension around the back. So hair loss from the front can be a fascial structural balance issue too. Let me just tell you about this one. So I had a gentleman who'd had extensive surgery for cancer on his liver, and he had extensive scarring on the outside as well as on the inside. He moved reasonably well, but the deeper layers must have been really stuck, because I was treating him for an arm and shoulder problem, and then one day he said to me about a pain that he was getting in the back of his head. He's getting a pain in the back of his head at the point of ejaculation when he was making love to his wife. And he hadn't mentioned it to her for obvious reasons, but essentially he said it was 10 out of 10 for a good minute. Can't think, it's so intense. And he says, and even an hour later, I can still feel where that pain in my head was. I thought to myself, I bet if you go to a GP and say, oh, I'm getting pain in the back of my head with ejaculation, you'll probably dewire them. They go, yeah, no, that can't be right. Anyway, I took the illogical assumption that the scar tissue being so stuck through his abdomen meant that what was happening in the low down didn't have any dispersal. It just went straight through up to his head because it was rigid and connective tissue that was holding him up. So I did some treatment around his tummy, some scar work. even putting your hand on or stroking lightly over scar tissue, probably for 2 or 3 times the amount of time you think you need to, will provide the sensation into the body. What I do with my therapy, although I've got all these high-level cognitive functionals going on, is I put input to the body. Now that input is not my skill, it's the communication from that input into the brain, and then we need the brain to process it and output. So normally my touch and the brain's processing going, oh, that's way too tense, and there'll be a let go. So it is all about the brain, but using touch and movement through the body to retrain the postural resetting center in our brain and allow us to hold ourselves well.
Thank you so much. And Jackie says all of a sudden she's got pain in the knee. All pain is on the right, nothing on the left. I guess it's all talking about it. It's bringing it all into attention. And just to
Or
read
on the
out,
right knee, and is it on the right side of the right knee or the left side of the right knee?
just details. And just to read out her text here, I'm absolutely full of tension and trauma and costochondritis. I'm sure you know what that is. I'm due an imaging scan on my pelvis, and consultants mentioned scar tissue from the gallbladder and some stones. Removed a year ago, the belly button scar is bright red. The others have gone. So right about giving you painkillers that causes the problems with my gastric ulcer. I agree with what you say about Western medicine. That's what they keep shoving down me. Would a physiotherapist be better for my pains or a chiropractor? I'm so fed up with them saying we need to keep you on pain meds. My pain has increased so much since the loss of my husband. That's dear
Yeah.
Jackie. Jackie, do you want to
Okay.
come up to speak to Karina, or is that enough
I've
information?
got
Yeah.
costochondritis story if you'd like to hear it.
Yes, please.
So I had a lady who used to see me at the neurotherapy centre where I worked. She was diagnosed as having functional epilepsy or something. It wasn't actually epilepsy. It related to anxiety, I think, but they sort of labelled her as psychosomatic. Anyway, I'd seen her for a while and then she developed this pain. Her diagnosis was costochondritis. Well, that's a doctor diagnosis. So costo means ribs, chondro means the cartilage, and itis means it's inflamed. So they're giving you nothing other than we can tell you where you're hurting. So the problem with the ribs at the front is, hold on a minute, I've got a picture. Is the ribs at the front are cartilage.
Is it laminated, Karina?
It is laminated. Hold on, hold on. The rib cage, I'm trying to get a picture from the front. I don't know, that's from the back, but can you see the ribs are blue? Sorry, the cartilage is blue at the front. So our ribs aren't bone all the way through to the breastbone, a bit like our nose isn't bone to the end, you know, just got holes. So this bit that's fairly solid is cartilage, and we have that in the front of the ribs as well. Have you had a bad cough or anything like that, Jackie? Any chest infections or anything recently?
No, I've had sinusitis.
Okay.
Very badly.
And how long have you had your costochondritis, and was it triggered by any illness?
I think it came after the gallbladder removal.
Okay. Yeah, it sounds to me like you might have scar tissue relating to, I would actually be tempted to look for a scar tissue therapist first.
Lovely, thank you.
I went on a course. I only did a couple of days and my friend's done it, but I can't think of the lady's name right now. Have a look if you want. Althea can remind me with an email and I can have a look up and see. Right, this is a picture of a muscle. This is behind the rib cage. So the blue bit is where your ribs are cartilage, not bone. So the muscles on the front of the chest, if they get tight, will be pulling on that. So anyway, I'll tell you about my lady. She had a whole load of other issues going on, and then she developed this chest pain. She was really tight and I couldn't stretch her out. And I said to her, you need to go to the doctors and get some pain relief for this, so that we can get the muscles looser, so that we can get rid of the problem. I think she went to the doctor once. You know what doctors like, they don't like to be told anything. So and you have to be careful how you do it. So she came back and says, oh, they didn't really give me anything. I'd even suggested to her, say to the doctor, the physio suggested that this might be helpful. Don't say to the doctor, this is what I need, but the physio suggested this might be helpful. She wouldn't do it. So that client had to pay for my time to be a health advocate at the GP. And when I was talking to the GP, I was explaining the problem with the muscles. And I said, what we really need is something that will sort of ease it off and relax. She goes, oh, some amitriptyline. I'm like, yeah. But she wasn't able to get that herself without a health professional there and having a conversation. So anyway, long story short, she started the medication to relieve her costochondritis. And the next week when I was seeing her, it was chalk and cheese, completely different, able to open up the chest and everything else. But the difficulty is if you've got scar tissue in the abdomen around the gallbladder, I would suggest if it's related to that, then that would be your primary problem. Now, I have always been musculoskeletal in origin, but when I realised that the pelvic floor is actually all involved, I need to do that. I went on a course to do pelvic floor assessment. And I also, the following weekend, there was abdominal release work, so viscera. So the connective tissue, the fascia around the organs can get tight, and that will cause problems. So one of the ladies on the course who was taking the course, she had laparoscopic surgery years ago for something, and she getting this back pain. She's a physio. She saw all her mates. She did sacroiliac joint stuff. She released all the muscles, and it didn't get better. Then she was just going for a beauty massage, and the lady went over her scar at the front, and that gave her pain at the back. And she goes, oh, it's a scar tissue. So she went on to learn about visceral release. Now, there is a technique between the duct of the gallbladder and the liver that you can actually press and release. So, you know, where the surgeons will have an answer, oh, just go and get your gallbladder out. I'm kind of like, press on a bit, it might fix itself. So I also, I'd had surgery when I was young, and I've had people come to me who I've treated that have had their appendix out, and the doctor said, oh, it wasn't appendicitis, but we took it out anyway. So I've had people that have, you know, got that as their primary. And I imagine it's really quite lucrative to do surgery on children, because by the time I was 11 or 12, I had too many teeth for my mouth, because obviously your structure comes up into your throat, your hyoid bone, and into your jaw. So my teeth started going wonky. So I had 7 teeth removed. So profit on the organ remove, all the dental work I've had done, and all the therapies. I've been to the doctors a few times. I've had an MRI scan. So yeah, the shame of it is, if people were better informed, that it seems complicated, but everything just needs to move, and you've got all these different levels in your back. So instead of just doing that and moving where you hinge, go really slowly and start to learn if you can separate, because then you'll get several healthy joints in your neck and just not the one that you're automatically used to using. So quick answer to the scar tissue, any other exercises. The exercises that I give for the lower back and the pelvis involves all those movements that I showed with the neck. So if you're lying on your back with your knees bent and the feet on the floor, rolling your knees side to side will do rotation. It'll massage the back of the pelvis and it will rotate the lumbar spine. So 30 seconds to a minute, get your synovial fluids happening. Obviously get up and have a wee, but if you do it first thing in the morning, then you loosen stiff joints before you come unstand. If you've got a couple of stuck lower back bones and you don't warm up in the morning, they'll just stay stuck and everything else will move. So on your back, lying on your bed with your knees bent, small range of movement, 30 seconds to a minute, will boost your synovial fluid and get your body warmed up. You can end that with a bit of all the way one way and all the way other way to do a stretch and have a couple of deep breaths. So that's rotation at the back. And then you've got tilts, pelvic tilts, where you would slump and arch the back, or in that position with the knees bent, feet on the floor, flatten your back into the floor and then arch your back, because that's using your flexors and your extensors in your lower back.
Yeah, I've been doing the pelvic floor exercises while I'm sick, but it's not done anything, obviously. But
Well, unless I assessed your pelvic floor exercises, I don't know if what you think a pelvic floor exercise is the right way to do it.
Yeah, I understand
I
that.
know there was a lady, she was the boss at the charity, one of the charity places that I worked, and she developed some problems. And I was like, oh, have a look if you like. And she says, I've been doing pelvic floor exercises wrong for the last 40 years.
Mm.
So, and I know when I was in the hospital, there was a physio who had trained many years ago. She'd had her children, she'd come back. She wasn't working as a physio, she was a physio assistant. And she was on the postnatal ward, and I heard her saying, you know, oh, well, if you're struggling, just clench your buttocks a bit. I'm like, so, you know, quality in how you're moving, because there's so many different muscles, and like I was showing in the spine, you know, bits go in certain bits. If you're not practicing moving them and separating them, then you're getting tight muscles, and that will mean tight joints. I've never seen a yoga person in their 80s, 90s, 100 that doesn't have either a humped back or a really stiff lower back. So even people who are doing yoga every day for many years are not mobilizing the joints in their spine and keeping them healthy. You need to do breath work, and you need to do individual mobilizing. So Pilates is quite good. Roll down, where you got to do one at a time, or lying on the floor where you lift up your bum. You're trying to lift one vertebra at a time. Intersegmental control. That's what Pilates teaches you. Core work, isolation, precision, flowing movement, and from the core. You want to work from the inside out. Anything else?
Amazing.
Thank you.
Thank you so much. And Jackie, thank you so much for your question and highlighting those things for Karina to answer there. So we have come to the top of the hour there, and I know you said that you're very busy. You've got a long waiting list, and you don't want any more work. So where do people?
Part of the problem is I have neuro clients. So people who have neurological conditions, long-term conditions, or they've had a stroke, you know, this spinal stuff is essential. You can't just strengthen an arm and leg. You've got to get that in. I can't remember why I was going to say that. I thought there was something important, but it might not be. Yeah, so because you've got those, they want you every week forever. You know, well, not forever, but, you know, rather than someone who's got a back pain, I'll see them 4 or 5 weeks and they're gone. My diary's free. When I get someone with neuro, they want to stay. So it's very difficult. When COVID happened, I was like, yes, my 2 10-hour days can be dropped. So, yeah. I've given you a YouTube channel, Block Therapy. Let me tell you the other one, which is the course that I went on. It's called Anatomy Trains. And he talks about trains, like some locals going just from one joint to the next, and some expresses that will go over several joints. So it's just the framework that I use. The reason why I'm giving you that is because he's got self-help. Massaging is different from fascial release. So he's got fascial release videos on there. When COVID was on, you can do self-treatment. So there might be something on there that's helpful.
So it's Anatomy Trains.
Anatomy Trains.
AINS trains, like
right.
Drift trains. Wonderful.
Like trains, yeah.
That's amazing. And Karina, that's amazing. It's, as always, so informative and in great detail. Thank you so much. And I hope that's
Hopefully
given
not too much. I did try and dull down some of my excesses.
I
didn't
know.
use medial or lateral once. I said, is it the left side of your knee or the right one?
Not even once.
Not even once.
Well, fantastic. And so informative.
If anyone's got any questions, they can forward on to me and I can signpost them. But yeah, unless you're living locally, sort of in Essex in Colchester, then I won't be able to. It's not so easy to help people effectively over Zoom when you've got the manual therapy side. So
amazing. Thank you so much. So I can put your email with the recording. Is that what you're saying?
Well,
I know you said you're very busy.
Yeah.
Just checking before I put the email.
My preference would be that they come to you first, because you might be able to solve it. Do you know what I mean? I won't, like, if people email me, the chances are it will scroll down and I'll miss it. You know, I can miss emails sometimes. So if anyone feels desperate for a desperate question that they haven't found an answer on Block Therapy or Anatomy Trains, then they can email you, and then you and I can have a conversation or do another one months down the line to cover it if we need to.
Okay, I'll put that with my email with the recording then. So thank you so much, everybody, for joining us.
I don't want any more work. I don't want any more work.
No, I know, because you're very busy. You've got a long waiting list. And so I'm thrilled that you've spared the time to come on to the podcast tonight. And I really appreciate you sharing your knowledge and guidance and information with people. I see hundreds of mirrors everywhere, everyone doing that in the mirror and looking at your shoulders, looking at your chin line.
You'll be surprised at what you can spot on yourself. Yeah.
Thank you so much.
And there's no reason why you couldn't just Google muscles around the shoulder, because if you've got something that feels sore, poke it. See if you can find a picture. If you go, oh yeah, that's that, then you know what your problem is. You know, there is anatomy out there. Obviously, a lot of people just want to go to someone to be fixed. But if you've got the type of mind, you know, the pictures are really useful. And, you know, like I say, asymmetry, range of movement and tissue texture, you'll be able to fix yourselves.
Absolutely. And in part of my course, one of the first things I teach people is to find out about your literal physical what's going on. Look at the bones and the muscles, understand what you're experiencing physically. So I think I'm going to put your recording underneath that. So as an extra focus of how to do that, because that would be really great to put that in there together.
I think it's very helpful because unlike the elbow or the knee, we can see what it's doing. This is, like I say, just some vague rectangle between our head and our legs, right?
Exactly. It's in great detail, and what a difference it makes from just making a few tweaks here and there or understanding what you're experiencing. So thank you so much, Karina, and thank you everybody for joining us. It wouldn't make a podcast unless we're all here together. And I've been your host, Althea Finch from the painfreedom.co.uk if you want to find out more about my method. And there are lots more podcasts coming up. We've got all sorts of wonderful people just like Karina. So do go along to that website and book yourself on the next podcast. But for now, thank you everybody for joining us. And Karina, it's been amazing to have you on and to be so informed. What would you like to leave people to go away with? A thought or a focus or a practical?
My take-home message would be to be responsible for your own health and not outsource that, because no one's more invested in your own health than you are. So whatever your problems are, yes, look and investigate, ask the doctors, but look alternative, look up the region, you know, and try and work out what you can do and just keep everything moving. Realize that a lot more needs to move than we're doing, and just keep moving more. Enjoy it, put some music on, because if you're smiling while you're moving, you'll do it more.
Fantastic. Thank you so much. And Karina's recording is going to be on my website by tomorrow, painfreedom.co.uk, and you'll see the details she's given us tonight, and you'll be able to see this recording again. Thank you everybody for joining us. Have a wonderful evening.
Thanks, bye.